First of all, I think we as a nation are very technology driven, and this can be proven by the fact that many of the students, they have their head down and they're using the mobile phones. So we are so much close to the technology this way. So, and addressing the audience, especially the students, the technology is driven by the students in a way that we are so much close to being close to health technology, and it starts from your very own home. Frankly speaking, if somebody gets a disease or somebody gets ill in your house, so what do? You get a call, you call your doctor, your close friends, your family doctors, and what do? You simply do your call consultation with them. So telemedicine is a more modernized way, being at home, and you can address these issues by having a consultation directly with the expert in their field, and you don't need to go to the hospitals. As a PMBC, because telemedicine is being driven in most of the hospitals now, but it's not too much that you say a very vast field that PMDC is taking any actions on it. But we definitely encourage, as a PMDC official, I definitely encourage the people who are using the services of telemedicine, they need to make sure the doctors to which they are having their consultation with, he or she, they should be a registered medical practitioner with PMDC, and they should be expert in their fields. And I think many of the doctors, they should adapt themselves to more technology driven in these days, because many of the famous consultants in Pakistan, they are not too much adapted towards telecommunications. When I search for a doctor online to have a consultation, you heard from your family members or other doctor communities that this doctor is a specialist in his field, but you can't find their name on the telecommunication. And there's no telemedicine service offered being with them. So I think the hospitals, they need to make sure to have their main consultants more adapted towards telecommunications. So the public who wants to get their consultation, who are living in different cities, and they cannot travel to that city to get their consultation, so they can be facilitated in that way. So I think the adaptability comes from both ways. The consultants, they need to be telecommunication adaptability should come from them, and the public also, if they have any issue arising in regard to their illness, they should be also more adapted towards adapting this field of telecommunication rather than visiting a hospital, because we know in Pakistan, hospitals, they are very much crowded, and the main source of infection, it comes from the hospital. Even if you don't get a disease, you take somebody, your friend or your family member, and when you're getting their checkup, you yourself get infected with that disease. So I think, but we all know that telemedicine, it has some limitations. I mean, the diseases which can be cured with the history of the patient, they are the most beneficial to be communicated through telemedicine. But for illness and diseases which do require physical examination, you need to visit the hospital for that way. So regarding PMDC, what you said, we are still not too much in recognizing telemedicine as a way of consultation, but we also not obstruct the way of telemedicine to be conducted by hospitals. I mean, when it becomes more common, then PMDC should take action in it, and we encourage the hospitals and the institutions to, I think, to get more certification and workshop for the consultants to get them more adapted towards this field of medicine, and to burden the diseases which have been spreading across Pakistan. So I think it's very important, because it is the future for decreasing the burden of health in Pakistan.